Hi and greetings to Dr. Fu. We are from Group 1 going to present about obesity during pregnancy.
What considered as obesity during pregnancy? Being obese is based on pre-pregnancy body mass index (BMI). Pre-pregnancy means body mass index before pregnant. Obesity mother has BMI 30 or higher before pregnancy. BMI can be calculated based on our height and weight. Risk of obesity during pregnancy. Firstly, gestational diabetes. This is a type of diabetes that can develop during pregnancy in women who do not already have diabetes. Usually, it will disappear after giving birth. Common occur in the second and third trimester. How gestational diabetes occur? It develops when our body is unable to produce enough insulin during pregnancy. Insulin is a hormone produced by our pancreas that acts as a key to allow blood sugar into our cell for use as energy. Our body produces more hormone and undergoes other changes during pregnancy, for example, weight gain. These changes cause our cell to use insulin less effectively, resulting in insulin resistance. Second, hypertension, which is high blood pressure. Blood pressure means force against blood vessel. Heart is pump blood into the arteries, blood vessel that carry blood throughout the body. Hypertension means the reading of blood pressure is greater than 140 mm per mercury. How to prevent hypertension during pregnancy? Firstly, know your blood pressure level before getting pregnant. Secondly, reduce food that high in salt to reduce our salt intake. Do an exercise program during pregnancy. Pay attention to the medication. Get regular prenatal checkup, and lastly, do not smoke or drink alcohol.
Next, obese maternal can also has high risk of getting cesarean section. Cesarean section, C-section or cesarean birth, is a surgery procedure used to deliver a baby through surgical incisions in the mother's abdomen and uterus, and this actually increased rate of cesarean delivery. Also, increased risk of pregnancy complications. Obese maternal will also increase risk of getting intrauterine fetal gametes. IUFD is a clinical term for stillbirth used to describe the death of a baby in the uterus. The term used when the death of a fetus occurs at or after the 20th week of gestation. According to World Health Organization (WHO), fetal death is defined as intrauterine death of a fetus at any time during pregnancy. Next, obese maternal will also increase risk of delivery very preterm infant. Preterm infant is a birth that takes place more than 3 weeks before the baby's estimated due date. In other words, a premature birth is babies that are born before 38 weeks of pregnancy and may be low birth weight. Neurotube defects or NTD is birth defects of the brain, spine or spinal cords. Anencephaly is the upper end of the neurotube fails to close. Consequently, brain is either missing or fails to develop. For spina bifida, is incomplete closure of spinal cord and its bony encasement.
Short and long-term complications during maternal are gestational diabetes mellitus, gestational hypertension and preeclampsia, venous thromboembolism, which is blood clot, miscarriage, pelvic pain during late pregnancy, obstructive sleep apnea, post-caesarean wound infection, postpartum complications such as anemia, depression and weight retention, and lastly, lifetime risk of cardiovascular disease. Besides that, complications during fetal are structural birth defect, microsomia, prematurity, hypoglycemia, stillbirth, shoulder dystocia, neonatal intensive care admission, asthma, autism, attention deficit or hyperactivity disorder, and early development of metabolic disease. Lastly, complications during postnatal are obesity, type 2 diabetes, cardiovascular disease, osteoporosis, cancer, metabolic syndrome, neurodevelopmental delay, and aging.
The first way to achieve healthy pregnancy is consulting with a healthcare provider. They will provide accurate and reliable information to manage and plan to prevent excessive gestational weight gain. It is include counseling, close monitoring, social support, and goal setting for maternal. Moreover, health professionals such as dietitians can create individual diet plan for obesity pregnant women to improve their health status. Secondly, physical activity. According to the American College of Obstetricians and Gynecologists, 150 minutes of moderate intensity exercise every week are very recommended for obesity pregnant women, with around 30 minutes of exercise each day to reduce maternal obesity and its complications such as preeclampsia and gestational diabetes mellitus. The safest activity are brisk walking or water-based exercise such as swimming or water-based workout. And lastly, practice healthy diet. The recommended weight gain for obesity maintenance is less than 11 kg. Therefore, they are advised to consume food that assist in controlling weight such as whole grain, fruit, vegetable, and nuts. Obesity pregnant women should follow a diet that high nutritional value including all macronutrients, vitamin and mineral, but low in food that contain saturated fat and high in glycemic index. Folic acid supplements are essential to prevent fatal neural tube defects.